of other legal other legal support that also enjoined. And this led to the Common Cause versus the Union of India judgment, which was passed in 2018, which laid down a lot of the which laid down a judgment on how a living will or an advance medical directive needs to be made. I'm going to read some aspects of this judgment. All adults with the capacity to consent have the right of self-determination and autonomy. And a person who has come of age has the right to refuse a specific treatment or all treatment or want alternative treatment, even if such a decision entails a risk of death. Especially this part is important, that even if this decision means death, it is the patient's right to decide whether a particular treatment can be done to him or not. And this can be done through a making of a valid advance directive, which is free from these reasonable doubt, which specifies that he or she does not wish to be treated. In that case, such a directive has to be given effect to. And this is part of the Common Cause judgment. In all these societies which I have mentioned, and a lot of the legal individuals also were part of the NGO or were collaborators with the NGO Common Cause and the Common Cause versus the Union of India 2018 verdict came up with this. So in 2018, we have already the foundation of how to make a living will. This is just a small part of the judgment. This is actually a 180 page judgment, I think. And while this tells about the right to actually make an advance directive and to say no, there is a part of the judgment that talks about how the living will can be made. And anyway, I'm going to be coming to that in a bit. So what has happened from 2018 till now? So for India, this came 40 to 50 years after it came up in the rest of the world. But even about 5 years after the Common Cause judgment, there were only a handful of people who were able to actually make a living will and register it. And these were mainly people who were within the legal system themselves and knew how to negotiate with it. That was how difficult it was to actually make a living will. That was the administrative difficulty behind the making of the living will. Now, you've heard me say a lot of these, before we come back to what happened after the 2018 judgment, you've heard me say a lot of these terms again and again. Do not attempt resuscitation orders, making of a power of attorney, what is an advance directive, what is a living will. These all come under the advanced care planning umbrella. All of these are different aspects of it. An advance directive is actually broader in scope than the current living will that we have. Basically, an advance directive talks about an individual when they reach a certain point of health in their life, what are the treatments that they want and do not want. The living will, as we see, especially the living will for us, for Indians, is activated only in times of terminal illness. A healthcare power of attorney is a part of the living will and also a part of the advance directive sometimes. A do not attempt resuscitation order is an order that we sign in the hospitals. Do not intubate order is also an order that we sign in the hospitals. Physician orders for life-sustaining treatment are only in the US. We don't have those. And organ donor registration is also considered to be a part of advance directives because well in advance you are saying whether you would like to donate your organs or not. So coming back to the 2018 judgment, in 2023, this judgment was simplified by the Supreme Court to actually make the administrative process easier. And that's what I'm going to be talking about in actually how to make a living will. I'm just going to look at some questions before we go to this part. This is the second part of the.
You can look at the questions later. We'll address them all later.
Okay. Is audio okay? Because I'm seeing.
Yeah, audio is all right. Audio is all right.
All right.
Yeah,
Okay. Yeah. So we're going to be looking at the whole process of how to make a living will. Step number one is what is a living will? Who should make it? When does it get activated? understanding all of this. Step number 2 is understanding your medical preferences, documenting them, also discussing with your doctor if needed. Step number 3 is actually here. So you choose your medical power of attorney, you inform them, and you document that too. And then step number 4 is signing and notarizing the living will, and then submission to the authorities. So, coming to who should make a living will. There are, in effect, about 3 groups of people who should try to make a living will. First of all, you have to be above the age of 18 to make it. Anyone who is above the age of 18 who could be healthy but is thinking of a situation such as a bad road traffic accident or any bad accident that leaves them with a severe brain injury that can cause maybe a vegetative state. If you remember, this is what had happened with Michael Schumacher after a skiing accident, and the last we know of him is that he is in a vegetative state and able to do very less of his own daily activities. One other segment of people who should think about making a living will is any individual who has been diagnosed with a chronic illness. They could have been diagnosed with the illness at any time of the illness. It could be an early illness or a late illness. It could be an illness that affects any organs. So it could be something which affects the brain, like dementia or Parkinsonism. It could be renal failure, kidney failure. It could be a liver problem. It could be lung failure or lung disease or heart failure. Basically, it is an illness that is going to be chronic and progressive. So they may make the living will for a situation wherein the illness has progressed to the extent that it will hamper their ability to choose their medical preferences. So we know that Sushma Swaraj actually had kidney failure, and she died about a few years after her kidney transplant. So this is one such example of who should make a living will. Another one is another segment is an individual who has been diagnosed with a devastating illness. This could be an illness which allows them only a few months or years of life. Imran Khan had got a brain cancer, a brain tumor and he passed away about, I think, a year and a half or so of declaring it. And so stage 4 cancer can be one such example. Now, when does a living will get implemented? I've told you some of this before. I've said that there should be a terminal illness. So, how do we know that? Your treating doctors must be convinced that you are suffering from a terminal illness that cannot be cured, that will not improve your quality of life in any way, or that one that can leave you in a persistent vegetative state. Secondly, you are in a position where you are unable to make decisions about your health. Either you are unconscious, unable to communicate, mentally incapacitated in some way or the other. This is because if you have a terminal illness but you are still lucid, your doctor will listen to you only. You will be the primary decision maker rather than referring to the living will. So these are some preconditions for when a living will gets implemented. At this point of time, I'm now going to go into exactly what you need to fill in order to make a living will. This is the template that Mr. Pradyuman was talking about. This template will be sent ahead, if will be sent later. If in the future you think that you do want to sit and make a living will, what I would suggest is download the template or print out the template, sit with it, maybe watch this video again. I think it is going to be up on YouTube, and start filling it start watching it from this section so that you can fill it along with how I explain it to you. So section 1 of the living will template is mentioning your personal details, your full name, gender, government ID, residential address, municipality, etc. Section 2 is one of the main sections, which is medical preferences or directions related to life-sustaining treatment. This is how the template is worded in the document that we will be sending you. And these 8 points that you see here, these are going to be mainly the main medical procedures that you need to think about in the backdrop of a terminal illness. How I would suggest you do this is that sit down with a pencil and this and this printed document. Look at each of these points. I'm going to explain what each of these are, and either you put a tick across it or you put a cross across it. So cardiopulmonary resuscitation is something we know that when the heart stops, so when the heart stops, the heartbeat reduces. That's the cardiac massage that we give. IV fluids and medications, including antibiotics. Then we come to dialysis. Dialysis is the way to do the work of the kidney when the kidney cannot. Ventilator or other kinds of artificial life support. That's when a tube goes through within your lungs and is connected to an external life support device to help you breathe. Chemotherapy for cancer, radiotherapy for cancer, surgery of any kind. And the last point is artificial administration of nutrition and hydration. Now, this is through the means of a tube. It could be a feeding tube, it could be a PEG tube, a nasal tube, it could be an IV cannula. So, fluids through an IV cannula. So, all this comes under artificial feeding. These are all the different types of life supports that medical treatment can at present offer. It's a good list. It's not a completely exhaustive list. If at this point of time you feel that you either have questions or you have a particular ailment which might require some other medical procedure also, consult your doctor, your family physician, your treating doctor, or your specialist. Basically, whoever is the one who is most involved in your care, and go through these again with them. And then when you come back to this document and edit it, in the first section, that is this, you will write about the procedures that you don't want. And in the next section, you will write about the procedures that you want. And I also want you to remember that this line that states that even if we withdraw life supporting treatment, we are going to continue administering care, which is for comfort, which is for alleviating pain, for reducing any kind of physical or bodily distress. So that goes without saying. Even if you decide that I don't want IV fluids and medicines, you will still continue to be given IV fluids, IV medications, which can help relieve pain or any other bodily distress. And then comes the section 3, which is wishes or desires during the end of life. Here you can mention where you would like to be in at the end of your life, whether it is a hospital, in a ward, at home. You would want to be not in the ICU. You can mention that too. You can name your preferred institution if you have one. You can also write down the name of the physician who you would want to be under. Then comes the section 4, which is one other important section of the living will. This is trying to nominate a surrogate decision maker or a medical power of attorney. So a medical power of attorney is going to be the person who is your representative, because you, the executor of the will not be able to speak at that time. So how do you choose your medical power of attorney? They should be preferably in the same city as you. They should be your age or younger. Think of whether they have an illness which might incapacitate them even before you. In that case, they may not be the ideal power of attorney. They should be someone you trust. They can be close or far family, a close friend, a close colleague, anybody in your circle who you trust and who knows your medical preferences. So once you decide upon who you want, you will speak with them and only then write their name down. Then we come to section 5, which is directions to be followed after death, which is also an optional section. Here you can mention whether you would like to donate organs. If you're already a registered organ donor, you can mention that. You could write about body or cadaver donations. You could write about last rites or funerals. If it comes to thinking about organ donations vis-a-vis age, usually individuals after the age of 70 or any individual who has cancer, we don't accept solid organs. You can still mention your preferences if you wish, and the hospital where you are will try its best to make it happen. But irrespective of age, you can still donate skin, eye, bone. These are some of the tissues that you can. So that's it. That's the writing aspect of your living will done. After this, the executor, that is you, the person making the will, signs. The executor and two witnesses go to a notary. The executor and the two witnesses sign in the presence of the notary, and the notary countersigns, and this is your living will complete. You can have either a notary or a gazetted officer countersigning this document. You don't need bond paper or 100 rupee stamp paper to write it. You don't need any other kind of legal aspect for this. Once the notarization is done, the living will is made. But after this, what needs to be done? After this, you should make 5 copies. Ideally, make all 5 as 2 copies and notarize all of them. One of them is going to be for you. One will be for your power of attorney. One will be for your doctor who's treating you. One will be for the hospital that you plan to be admitted to. And the last will be to your local government office. This last one is the most important. That's the one that is that you that is mandatory to be submitted. In Mumbai, the ward office will be your local government office. In the rest of Maharashtra, the Maharashtra government actually has released a list of custodians for the living will in all the districts. So there are a list of, I think, about 400 custodians for the Maharashtra government. The rest of the states are yet to follow suit. Many of the states are kind of trying to catch up, but I think we should definitely see some work going on in the next few months because the LSIC task force and the Indian Association of Palliative Care, all of these are trying to work in conjunction with Ministry of Health in each state to try and make this process easy. There was one question that Mr. Pradyuman had asked about whether a living will that is made in one state can actually be applicable in another state. So that the answer to that is yes. The plan is that there is going to be a digital repository of the living wills, which will be Aadhaar or PAN linked. And so, if an individual comes to a hospital with a living will, and the family informs the hospital that they have, the hospital will have a way of authenticating it. So that will be through the digital repository. And for now, the important thing is that the ward office should have it. And so then the ward office collects it and then gives it uh, ahead. I'm going to end with, I think, some common myths because I also want to give adequate time for people who want questions. The living will, these are some common myths that people who have come to me for making the living will have had. And so I just want to dispel some of them. I want to tell you that the living will cannot be activated for a non-serious illness. So, say you have been admitted in the hospital for a surgery, for a heart attack that the doctor thinks that treatment can be done. For these illnesses, even if they are serious or if they are non-serious, the living will not come into consideration. Some people feel that because I've made a living will, my family will not have a say in my treatment at all. Your family is still going to be there to guide treatment decisions. But in the case of a terminal illness, it is your power of attorney who has primacy. The living will gets activated the moment I enter the hospital. Say I have an accident and I enter the casualty and I can activate the living will. That also does not happen. Most likely, the scenario is going to be that you come into the casualty, even if it is as a sudden illness, you will come into the casualty and doctors will perform most life-saving measures because it is very rare that a person just walks into casualty with a terminal illness right from the beginning. And so you will probably receive treatment in the hospital for some period of time before actually this discussion happening that, okay, this illness does not look like it's going to improve. And that's when we need to start activating the living will. I will not have a say in my decision making after I have made my living will. That's also not true. If you are awake, coherent, you can communicate, you are the boss, you get to decide what happens to you. I think that's the end of my presentation. I'm going to stop sharing now. This is my email ID in case there are any questions, and I'm going to just have a look at some of the questions.
Very much. Thank you very much. I have a few questions that have come in here as well as on my WhatsApp. But first things first, there's been a question about the PDF. So, as you all know, that this session, the recording of this is going to be on the Seniors Today website on Monday evening, along with the takeaways, which are also put up. And along with that, we will also have the PDF attached, and you can download that. We will also give you instructions as to how to download it. And if you still have a problem, we'll also tell you, we'll give you an email address which you can use and send us a mail, and we will send it to you. If you have any of our Seniors Today team members email address, you can also reach out to them, and we can even WhatsApp it to you. So Mr. Kashi Vishwanathan, don't worry, we will, in case you want the template, we will have it sent to you. In the meantime, there are some questions. Doctor, we have there's you just set up this center in Hinduja Hospital in Mahim. What has been the response to that so far in the last 2 months?
There have been a lot of people who have been interested in making a living will. I won't even call them patients, because we have people with absolutely, in the pink of health, no illness, fully active, walking in and saying that I want to do this just so that I'm able to plan for my future. In fact, sometimes I know that individuals are doing this as part of estate planning. So they are making their financial will, and at the same time, they are also making their living wills. Overall, the response has been really good. I am also astonished to see 189 participants at the webinar right now. It's been positive, mainly positive, I would say.
So, right now you have this in Mumbai, and I think Mumbai has only one hospital which has set this up. What about the other cities? You mentioned about other states also following suit, but is this facility available in other hospitals? For instance, there are hundreds of hospitals in and around Mumbai and other cities. Is this facility available elsewhere?
They're soon going to start. So stay tuned. I think all the hospitals, especially when it comes to major cities, a lot of the hospitals around are going to be starting living will clinics. For folks in Bangalore who are listening in, there is a Death Literacy Festival which is going to happen on the 23rd and 24th of August at the Bangalore International Center. I think that's in Domlur. And there is going to be a kiosk over there also, which is going to talk about making a living will. So if there's, if someone is really interested in wanting to know, the festival is also amazing. It has a lot of discussion around how to talk about death and towards death literacy. But there is also a kiosk for how to make a living will. We're in fact planning something for that. Other cities, it's going to be started soon in most cities. So I would say just keep your eyes peeled.
Right. And is there in case it's not there, and one wants to get more information, is there a central email address of a palliative care, the association, etc., which one can reach out to?
I'm going to what I'm going to do is I will put down the website link of the place where you can download a lot of information about the living will. I'll just put that in the chat in a bit. There are some FAQs that I have which I can send across to you, and we at Hinduja also offer teleconsultation services. So in case in the next month or so you aren't finding places close to you who are offering how to make a living will, then that's where you can do. And I mean, of course, this webinar is always there to help.
Right. I looked at the template that you have. It's not the easiest to fill up, etc. So is that what the clinic at Hinduja does in terms of helping in the filling up of the?
Yeah. So we go through it. Even if anybody who has the template, I mean, everybody is going to have the template now. what I would say to you is it's section 2 and section 4, which is most important. If you don't fill in the sections about wishes at the end of life or wishes after death, none of that is as important. What is legally binding and what is most important for you is documenting your medical preferences and choosing your power of attorney. The other thing that's very important is just having this conversation with your family, letting your family know that these are my thoughts, this is what I want. Even if for some reason or the other you don't end up notarizing this will, or don't end up submitting this will to the government or to the authorities, your family will still know, you will still have had the conversation. And when the time comes, I have seen most families want to do right by their loved one. In fact, they want to do what their loved one would have wanted. And a lot of times there is worry that I wish I had this discussion, or I wish I knew what they wanted.
Because as you mentioned, if it's not necessary to submit it to the government office, that's good news, because in a city like Mumbai, and I'm sure most of our the audience here, they don't even know where their ward office is located, and I'm not very sure whether the ward office folks are really very friendly. It's quite an effort to deal with government departments anyway.
So the reason I'm saying that talk to your family is that at least your family will know. If the living will is not notarized and submitted, then it's not legally valid, it's not legally binding. But it's still, if you've spoken with your family knows what you want and will at least try to respect those wishes when it comes.
Right. There's one question from Buchi Rama Sharma. She says, is adherence to the living will, is it a mandatory thing? You said it can be changed later on, right?
If you feel like you want to change the living will, you will go through the same process again of everything that I have outlined up till now. Is it legally mandatory in the sense that if a doctor feels that an illness is terminal, then they have to go through the process that has been mentioned in the Supreme Court judgment and outlined in the living will, and carry things forward according to the wishes of the person who has written the living will.
So we've had a few questions about euthanasia, and this Buchi Ramasarma has asked this question about, can one opt for euthanasia?
Yeah.
Euthanasia
is illegal in India as of now. Euthanasia or medical assistance in dying, either of those are illegal in India. The living will is not equated with euthanasia. Creation or documenting your advance directives are also not equal to euthanasia. Euthanasia is, if you ask me for a definition of it, I would say it is the administration of a drug with the explicit intention of ending a patient's life. And
sorry, there's something with,
yeah, I think that the lights have gone off in this thing. I'm just going to switch off video and okay.
Yeah, it's okay. Yeah.
So euthanasia is the administration of a drug with the explicit intention of ending a patient's life, and this is at the request of the patient themselves. Suicide and euthanasia are both illegal in the country of India. There has also been a lot of talk about the Supreme Court judgment using the word passive euthanasia, using the term passive euthanasia. And so, is there a difference between active versus passive euthanasia? Most of the medico-legal and the palliative care fraternity do not recognize this differentiation of term of active versus passive. There is only one euthanasia, and that is what I have said, giving a drug with the explicit intention to end a person's life at their request. In fact, most of the palliative care community also do not agree with the Supreme Court using the word passive euthanasia to describe withdrawal of life supporting treatment. So, for us, ethically also, it is different because here you are withdrawing artificial life support that is man-made, and that is in a living will or an advanced directive. Whereas in euthanasia, you have the active intention of killing a patient. So there is an ethical difference, and there is also a legal difference because living will is legal in India, whereas euthanasia is not.
Right. One last question that I have is, and we've had quite a few cases that have been that we've come across where uh, parents and their children are not in the best. The relations are not really ideal, and they are almost a burden. Children think that they are a burden, and so could there be cases where uh, parents, grown-ups, old senior citizens are being coerced by their children to go in for a living will, and how does one of a counseling session that is conducted with the person who is going to be doing it? Is a person certain? Can there be some red flags? Can you know that? Well, it may not necessarily be uh, uh, a voluntary decision taken by the person.
So this is actually a concern that the Supreme Court had. And much before the actual judgment that passed the creation of the living will, prior to that, the Supreme Court had initially said that advance care directives should not happen because they will be misused. And then the 2018 and the 2023 verdict by the Supreme Court actually allowed the making of a living will. But this is also the reason why there are so many administrative procedures involved in the making of the living will. In fact, that's why it was more cumbersome before, and we have tried to reduce the cumbersome nature of making it, but there are still a lot of checks. The first is that it is going to be the person themselves who makes the living will. So if a person's loved one comes to me and says, I want to make it for them, I don't encourage.
Sorry, your voice is breaking. Your voice is breaking.
Okay. What part did you not hear?
Dr. Khanna, your voice was breaking. The last question, the last response.
Yeah, just a minute. Okay.
It's better now. It's better now because, yeah.
It's better now. There are many fail-safes to actually prevent this kind of coercion or prevent this kind of problems of being coerced into making a living will or doing it under duress. The first is that the person who wants to make the living will, they themselves come and make it. Nobody else can do it for them. The precondition that I said about someone being terminally ill has to be ratified by two medical boards. So that is a total of 6 doctors. So if the treating doctor believes that this is a condition which is terminal, 6 other doctors have to come and verify the fact, discuss it with the power of attorney before actually going ahead with whatever is written on the living will. So there is a proper documented procedure, and all of this needs to be documented within medical records while doing it. What I have advised patients is that sometimes they have come in with emotional distress, or while in emotional distress. It could be because they have undergone a serious illness, or they have been recently bereaved, they have seen a loved one undergo a serious illness. I would strongly encourage them to revisit their living will in 6 months or 1 year's time, and see if the things that they have decided initially are still the same. So this is one type of counseling that we do.
Thank you. In fact, there's a person, Mr. Gopal Pujar, has said, can I come to Hinduja Hospital to help to fill the form and finalize it? Is any letter needed from a family doctor or a doctor treating?
Yeah, you don't need a letter from a family doctor. You can come anytime.
There are quite a few other questions that have been asked, but if you do look at the presentation once again, which Dr. Smriti Khanna has made, you can have most of your questions answered. We will try and have another session on the living will in a few months from now, because given the interest that is there in the topic, and we've heard a lot of people telling us, some people have said that they couldn't be there today. So with your permission, we will perhaps have a session. We could even have a session in Hindi for the benefit of people who prefer advice in Hindi. So we will do that in a few months. Thank you very much, all of you, for coming here. The site is seniourstoday.in, SENIORS today.in. All other information, some of which Dr. Khanna has mentioned, we will put it up with the article on Monday evening, so you can have a look at that. That's it for the health webinar today. We will be back once again next Saturday at 5 p.m. as the day when we do our health webinars. So stay safe and stay happy. Thank you very much.